Ms. Traynor. Good morning, Ms. Kelly.
Morning.
Good morning, Millard.
Right, good morning all. Right, when you're ready, Ms. Traynor.
Thank you, Millard. Good morning.
Morning.
I wonder if you can tell us your full name.
SallyAnn Kelly.
And you are the Chief Executive Officer of Aberlour Childcare Trust, is that right?
I am.
You provided a statement to the inquiry, I think, in December of last year, and along with perhaps some supporting documentation. And for the benefit of the recording, that bears the reference SCI WT 0958, 5 zeros and then a 1. You should understand that all of that information will form part of your evidence that the inquiry will consider. But I wondered if I could take you through some of the parts of that statement and perhaps explore them in a little bit more detail. First of all, how long have you been in your current role?
10 years in June of this year.
And I think you say that your professional background is that you worked as a social worker for local authorities for some considerable time.
Yes, I worked as a social worker in frontline practice for 6 years and then as a manager for a further 12 years in local authorities.
In terms of Aberlour, are you able to give us an overview as to the objective of the trust?
So Aberlour is a children's charity established in 1875, and our objective is to work with families that face adversity across Scotland. That includes families in communities who are struggling. A lot of that is poverty related, but not exclusively poverty related. But we also look after children in children's homes. We offer support to children affected by disability, both in the community and in short break services and in residential services. We offer foster care as well, and we are also the sole provider of advocacy support for the unaccompanied children who arrive in Scotland and are seeking asylum or have been trafficked. So that's the broad range of our services.
In terms of the residential services, are you able to give us an idea as to the extent of those? How many children, for example, are in placement?
So within disability, we have a combination of children who live with us on a residential basis and children who come for short breaks, perhaps once a week, once a month, with complex needs. So in total, there are around 250 children in that group of children. Only around 30 of them are in residential type placements. In terms of children in children's houses where they have been removed from their family home or can't live there because of safety reasons, we have again just over 30 children within those houses, and we also have children within foster care, so just around a total of around 60 children either in foster care or in residential care.
And I think in your statement you say you have around 700 staff and 200 to 300 volunteers.
Yes.
Turning then to the organisation's response to the pandemic, I think at paragraph 20 of your statement you say, our ethos is about getting alongside families where the parents might be experiencing significant difficulties, and we try and understand what's going on with them. And I wanted to ask you about that aspect of your work, which is getting alongside families. Is that something which you were keen to ensure was maintained despite restrictions being in place?
So that was very situational in terms of how much we could do that during the pandemic, because there was rules in place that obviously meant that we couldn't have face-to-face contact with families in some circumstances. But that whole relational approach where we actually get alongside the people that we support extends into our residential care, into our short breaks. So we needed to think very quickly about how we actually could maintain those relationships even if we weren't in front of the families. So we talked to families about how we could do that best during the pandemic. At the beginning of the pandemic, I think we were all a wee bit bemused about what this might mean for us as we moved forward, but we were certainly getting information that this was not going to be something that would be resolved in weeks. It was a marathon rather than a sprint, so we needed to prepare for a marathon in terms of how we engaged with families. So we needed to quickly assess how we could use digital and IT, for example, how we could support families and communities through, you know, safely distanced visits outside with families, how we kept in touch via telephone, etc.
I think you say within your statement at paragraph 37 that as a leader, I was clear that we would not be losing contact with families. And I said to my team that if they considered themselves essential to a family support structure before the pandemic, then they were essential when it came about. I wonder, the services that you deemed to be essential at that time, were you able to continue those? So
broadly, yes, we had to do some of those in a different way. As I said, you know, so our children's houses, we needed to continue to support our children and provide love and care for them. We looked at those and there was concern around our staff group, around transmission rates and how they protected not just the children but their own families. So we changed shift patterns so that our staff could, by their own voluntary agreement, they stayed with the children overnight, so that we reduced the footfall in our children's houses, and the children had a much more predictable staff group around them to support them, because they were also afraid and they were also having disruption to family visits and things like that. So our response in our children's homes was very different from the response in the community, where we were supporting families in the community, and we support a lot of families in the community, whether it's in Glasgow or Falkirk or wherever, where there's potentially high risks around children. These are families where children are potentially on the verge of coming into care, who are potentially needing more specialist services if families aren't supported. And it was in that vein that I said to our people, if we were important supports and essential supports to those families before the pandemic, we remain essential supports, so we need to be available. So we did not furlough any members of staff during the pandemic. Everybody remained working. They worked in a different way, and we actually just spent time looking at how we not just kept in touch from an emotional perspective with those families and from a child safety perspective, but also practically how could we support those families, because what we found was that families' usual networks were being curtailed. They were not having access to the support that the state had previously provided in many ways, so we needed to be proactive in terms of making sure that we kept in touch with those families in the community.
I'm interested in that aspect of the support from the state perhaps no longer being available. What I think within your statement, I see in some instances that was withdrawn virtually overnight as soon as lockdown was announced. What type of services are you talking about that were withdrawn from the state?
So we work collaboratively with social work services. So we have families who have regular visits from social work and social care within communities. Obviously we work with education, and education ultimately was schools were closed as well. So you know, there's a whole host of things that impacted, even things like accessing financial support for families. It was a varying picture, but they could no longer get access to, for example, the Scottish Welfare Fund if they were having difficulties, financial difficulties, because some elements of that were not available in certain parts of the country. So we needed to think sequentially about how we actually tried to fill some of the gaps that were being left behind.
Talking about that financial support, I think within your statement at paragraph 26, you tell us about something which you quite quickly, I think, set up called the Urgent Assistance Fund. Can you explain a little bit about the purpose of that? So
the Urgent Assistance Fund was already in place within Aberlour, but our funds that are available to us on an annual basis before the pandemic probably averaged around £50,000 a year, and it's a fund that is specifically targeted at children, families with children who are experiencing severe financial hardship. So during the pandemic, or just in the run-up to the pandemic, I had a conversation with a couple of senior managers, and we looked at what could be in front of us, and my position was that if there is a pandemic of the proportions that we are imagining just about to happen, then the people that are potentially most greatly affected will be the people with the least, the people that are furthest away from power and privilege, and we really needed to think about how we could get support to families, even families who had been furloughed and were getting income, for a lot of those families, they were already on the margins of poverty. So that drop in income would have a significant impact. So we needed to think about how we basically ramped up our urgent assistance fund and grew it to the point where we actually could make a much bigger contribution in a national crisis, really.
And you, I think, tell us the figure. Do you know how much money was distributed in that sort of 2-year period?
Yeah, from March 2020 through to the beginning of April 2022, we distributed £2.3 million.
In terms of families who are either seeking support or it's identified that they have an urgent need, what immediate needs were you seeing at that time?
There's been a clear pattern over the last 3 or 4 years in terms of the requests, and those requests are for money for electricity and gas, money for food, and money for children's clothing. And those are the big asks for families. And we have a very distinct approach, I think, and that we also decided at the beginning of the pandemic that we really needed to review our internal processes for our urgent assistance fund to make sure that families got the money at the point that they needed it. And that meant that we needed to take some bold decisions about how we paid that money. So up until the pandemic, the money would always be paid into the local authority bank account for social workers to distribute, or health, or housing. But because of the change in local government practice and the lack of availability of people to actually get the money to families, we did take the decision that on occasion we would pay money directly into families' bank accounts and they would be able to use it as they saw fit. But we did take and still take a cash first approach. So we don't tend to provide goods to families, we provide it in the shape of cash. Because all of the evidence, despite what the prevailing view of the public might be, is that if you give families money, they will use it wisely and for the intention it was meant.
Are you essentially saying your experience is that people don't take advantage if they're in that situation? Yes. You talk about, within your statement again, the increased use of technology immediately after the lockdown period, and that might have had an impact on vulnerable families more than families just generally. I wonder if you can tell me what you mean by that, and if you have any experience about vulnerable families and technology. Well,
we saw a huge increase in our requests for assistance through the Urgent Assistance Fund. So that was one lens that we looked through. And when we talked to our families who were living in communities, then they had real challenges in relation to accessing food at an affordable price. Transport links were compromised in some areas as well. So if you look at the Urgent Assistance Fund, we supported nearly just under 20,000 people during those 2 years. And that was a huge increase in the volume that had gone before. And it was for basic things that people were asking for support. But within our children's houses and also within our children with affected by disability, these are families that are hugely resourceful but have very few resources at their disposal. So they do the best with what they've got. But actually, we know that they were going to be negatively impacted, not just financially but also emotionally, because of the withdrawal of some supports that they relied on.
You gave us a figure there for the number of people that you supported during the pandemic period, something just under £20,000. Are you able to give us any figure of the number of people you would expect us, or you did support, in an equivalent period immediately pre-pandemic, even if it's a guesstimate?
It would be in the hundreds rather than the thousands.
In the hundreds rather than approaching 20,000. Yeah. Thank you.
One interesting aspect that you highlight within your statement is that in your experience, some families fed back to us that lockdown just simply wasn't something which was different for them. It was just their normal experience of life and the daily routine. I wondered what you meant by that.
So I was quite struck when we went into the pandemic, we had daily meetings with staff around just what was happening and trying to keep people up to date with guidance, etc. And part of that was about also getting feedback. And very early on in the process, the prevailing narrative on the TV was about how people were going to have to sacrifice many things in relation to keeping each other safe, going out for tea, going to the cinema, all of that closed down. And I was really struck by the fact that our families, some of them said, well, actually, welcome to my world, because I can't afford to go to the cinema, I can't afford to go out for tea. So this actually, from a social point of view, doesn't feel hugely different to me, other than the fact that I can't pop in and see my neighbours or my family. And so it was a sobering reality for us in terms of actually what people's experiences who live in poverty were like before the pandemic, and have remained the same since the pandemic.
In terms of the guidance and the information that the organisation received, at paragraph 49 of your statement, you say that certainly in the early stages you felt as if you were scrambling about for information. I wondered, reflecting, can you give any examples about what you think was missing?
So the pandemic, I suppose from our perspective as a children's charity, was very much in the early days of it, and it probably continued actually beyond that, was framed through the lens of something that was having a very significant impact on the older population. And that's true, it was. Nobody could dispute that. But there was very little recognition, I think, of the impact on children and the part that children played in the pandemic. So albeit, the inference was, and I think rightly we now know, was that if children became infected, generally they would not become seriously unwell, but they could pass the disease on. So what we were looking at was a situation where the guidance that was being produced was not child-centred, was not child-focused. So we then had to try to interpret it in a children's world in terms of what that would mean for us. For example, our children in our children's houses, that's their home, that's where they live all of the time. But there was guidance around residential establishments needing to wear PPE and masks. And our children in children's houses really need to understand who's with them, the context that they're living in. They don't respond positively all of the time to, new rules and regulations being in around the house. And we needed to think really carefully about what that would mean for us in residential care. And we were trying to get advice, actually, about the use of PPE in our specific residential care settings. And that remained a difficulty during the pandemic. So we were seeing guidance change on a regular basis as more became known about the disease and the changing variants, etc. But none of it really was, none of it was translated totally to a children and family perspective.
You say, I think in paragraph 52 of your statement, you actually wrote to the Scottish Government on more than one occasion asking them to be more explicit about children in care and children with disability and how the guidelines are supposed to impact on them. Do I sense some frustration in you saying that?
Frustration in the sense, disappointment more than frustration. So early on in the pandemic, I did write to the Scottish Government in those terms because I could see a situation unfolding where our staff were uncertain about what the rules were for our staff and for our children in children's houses and children affected by disability. So not only did I ask for that guidance, we also offered to support the development of that guidance, because as a well-established and respected provider, we were already putting in place processes that we felt were helping us to get to a space where we felt that we were operating as safely as we could. So we made an offer to support the writing of that guidance, but that was never taken up, and the guidance was never received, despite a promise of it coming out.
Amplify on not taken up, if you don't mind. Did you receive a rebuttal or just not a response?
No, we received a response saying that they were working on the guidance and we should anticipate it soon, but it never came. So that's disappointing and frustrating, but what it did for me as a leader within, you know, the biggest children's charity in Scotland, it meant that I needed to just focus on the day-to-day operations and try and keep our children as safe as we could within the context of the public health advice and the Scottish Government advice. And we had conversations with Scottish Government on a number of occasions at different points within the organisation about guidance. We didn't let it go, but we didn't get a satisfactory conclusion.
And I think you go on then to say that, in fact, when you didn't get specific information from the Scottish Government, you really relied on what you say is the coalition of care and support providers in Scotland for information generally about care.
Yes, so the coalition of care and support providers in Scotland at that point were connected into briefings that were happening at the Scottish Government level, and they were very good at putting out the guidance as it was coming out and changes. But it was still very adult focused guidance, but that was very helpful to us. So our head of quality and safeguarding actually took that guidance almost on a daily basis and tried to interpret it from a children's service perspective and then translate that into anything that would mean changes for us within our houses and with the families that we support.
You've mentioned the area, perhaps, of the use of PPE in children's residential settings. Is there any other areas which you think it was crucial, really, that you had information or guidance about that you didn't get, that you can think of?
So the use of PPE, yes. The other area that I think the state could have been much more explicit about was how we maintained the relationships between children and their birth families for children who were in care. And again, we tried to address that as best we could within the kind of practice, the best practice that we offered, but there wasn't a consistent approach to that across the country, and I think that was a potential difficulty. We were fortunate in the sense that our children actually during the pandemic were broadly very, very settled in our houses, so we didn't have an emotional response, if you like, from the children around the lack of direct face-to-face contact there was with families. But we tried to maintain that contact, again, through video messaging and by keeping live those connections. But again, you know, that's one of the lessons I think that we need to learn in preparation for any subsequent pandemic, is really understanding the importance of those relationships to children and families and how we, as a state, ensure that they're maintained in the best possible way.
Can I take it from what you're saying that certainly in some residential settings, direct contact between children and their birth families was terminated for a period?
Yes, that was. But direct face-to-face contact, yeah. But there was always ongoing discussion with the local authority about, you know, seeking permission, can we look at this? Yeah.
Are you aware if there were any explicit guidelines about that situation where a child lives away from home and is supposed to have contact with a birth family, whether there was guidelines about whether that should or shouldn't happen?
No, not guidelines. I mean, most of our children are subject to care orders, supervision requirements through the children's hearing. So there will be conditions on those supervision requirements at times, not always, but at times around family contact, but nothing that was a direct response to the pandemic that I'm aware of in those times.
So it really was up to you and the individual residential services to interpret whether that was or wasn't allowed at certain times?
Yes.
Am I right in thinking that perhaps there was a period where it was terminated, direct contact was terminated and it went online, but then it perhaps moved to maybe a more socially distanced or outdoor environment?
Yes.
And how did that affect some of the children and young people that are in your care?
So we have very small children's houses that offer good levels of support to children. They're quite modern in their thinking. So we would always work with the children to prepare them for that. And as I say, we did not have huge challenges from our children in terms of their response to the COVID pandemic. They were They were very nurtured in the houses that we have, and in the main, they responded really well to the advice and the guidance that the adults that were looking after them offered them.
In terms of reintroducing some direct contact, was there an introduction of social distancing or the use of PPE, for example, in parental contact?
So that would very much depend on the needs of the child. So we do have children who live with us on a residential basis who have compromised immune systems. So our approach to PPE in those situations would be different to children in children's houses who don't have underlying health conditions. But we would certainly, in the main, we would be relying on people testing and try and have those meetings. Yes, socially distanced, but and ensure they were as safe as possible. But we would not have required full PPE for people coming to see their kids in a children's house.
Do you have any sense as an organisation as to a potential lasting impact on that period of lack of contact between birth families and children and young people?
So I think one of the issues that we continually face, actually, of children who have been removed from their families is that connection with the birth family and how strong or otherwise that is. So it would be very difficult, I think, to make a bold statement about the impact only of COVID, of disrupted relationships, because those relationships historically have been disrupted prior to COVID and remain disrupted after COVID because of other complex situations in families. So I think it would be really hard to make a definitive statement on that, to be honest. What I can say is that, from the perspective of our children experiencing the COVID pandemic more generally, we see a mixed bag of evidence in terms of responses. So some of our children, I've talked about them being much better in terms of their self-regulation during COVID. They told us that was because they didn't have to navigate an education system that felt unhelpful at times to them. So they were being supported with their education with key workers in the houses, and they actually responded very well to that. Whereas other children responded really were quite distressed about not going to school. So it really depended on the circumstances of the child. And what we also know is that a lot of families who, when schools closed, were then having to educate their children at home, got very stressed about that because they themselves possibly had low educational attainment. They didn't have the tools at their disposal in order to keep the child linked into the education setting. So we needed to do a lot of work to get physical resources to families in the shape of tablets, in the shape of connection to the internet, so that the children could at least try to learn. But that did create, I think, a lasting pressure in families.
You talk about the impact of the very initial lockdown period in the children's residential settings, and I think at paragraph 53 you say, interestingly, that houses were perhaps more settled than they had ever been. I wondered why you think that is.
So the children were simple. So we work with children with significant emotional and behavioural difficulties, and we work with children who have had disruption in their background as a result of family difficulties. So we have experience of dealing with quite high levels of distressed behaviour, for want of a better term. And we had already started a process of making sure that we dealt with that distressed behaviour in the most positive way that we could. But actually what we saw during the pandemic was that our houses and the children in our houses displayed less distressed behaviour than they had before the pandemic. We have a variety of children who are not in full-time education within our children's houses because sometimes their distress is seen in education settings as well. And those children were much more settled as well. And when we talked to the children about it, they were able to tell us how difficult it is for them to navigate the education system as it is at the moment. And part of that is about their experiences of disconnection from adults and their inability to trust. And part of it's about the fact that because of that disruption in family lives, their educational attainment is probably not as advanced as it could be and should be, and is not comparable to their peers. And all of that creates stress for them in the education system that they then need to try to navigate. And what they have said to us is that sometimes that can feel like quite a hard place for them to be. And so not having to deal with the stress of dealing with the stress of navigating the education system for some of them actually resulted in better outcomes for them, not just in terms of their everyday living, but also in terms of their learning, because actually sitting with their key workers and working through the curriculum with a trusted adult actually proved really helpful to them.
Maybe some of the external pressures that they might have felt were just taken away because they weren't able to move externally.
Yes.
You go on to say that time allowed you to continue to work with the children and effectively do more perhaps intensive work with them. And you give an example at paragraph 64 that as to the work that you did on reducing restraint. And you say we were really able to progress the work with the children and staff during COVID to the point where we almost eradicated the need for any physical interventions. I wonder, can you explain a little bit more about that?
So within residential care in Scotland, there is a history of planned physical interventions if children are very, very distressed. Now, to put this in perspective, that is that our staff are trained in physical restraint of children, which could be about turning and guiding a child. There are holds that people are trained on, but we very rarely use those holds on children. But what the very concerted work that we did alongside our children in our children's houses showed us was that with a different attitude and a change in culture, we did manage to eliminate restraint in our children's houses during the pandemic, and we have maintained that position. So our children have quite different relationships probably with the adults that they are living with, and they're more, there's a better understanding. And we did this as part of my commitment to providing the best possible residential care for children. I think it's well documented how badly wrong that's gone for children in the past. So it's a real commitment from our organisation to do the best that we can by children, with children, in relation to their day-to-day living. And we were supported in our initiative by the Promise initiative in Scotland. And so there is published work on the project on reducing restraint, and I think there's a number of opportunities that are being put in place to share that learning across Scotland. So we were doing it anyway, but COVID allowed it to accelerate, really.
And how have you been able to maintain that, given that effectively life has resumed and some of the external pressures will have resumed for the children? So
the practice model that we have with our children has changed in the sense that it was always probably a good practice model, but we've enhanced it, so all of our staff can access psychological support from a psychologist that we employ. We've very clearly focused on trying to support our adults in the houses, our staff, to really understand the impact of early adversity and trauma on children, and to also, to be honest, respond and understand their own experiences potentially of adversity in childhood, and then look at how that can change their practice. So there's an ongoing process of support in place within our children's houses. So part of that is the psychological support, part of it is access to training, and part of it is about how we actually communicate as adults within the houses and how we communicate with the children.
You've already made reference to there being perhaps a difficulty within children's residential settings about PPE and whether PPE was appropriate or not effectively in children's own homes.
Yeah.
I wanted to explore that in a little bit more detail with you, and can you tell us exactly what the difficulties were, and if you have any anecdotes about how that was borne out within the residential setting?
So we very much try to create environments within our children's houses that are very home-like, so they're not institutional. And we therefore try to minimise anything being introduced into those settings that would institutionalise children's experiences. So there was a real issue for us in the sense that none of our children within the children's houses have had immunosuppressed illnesses. They had no underlying health issues. This was their home. This was their home. And we needed to respect the fact that this was their home. So we did have a conversation about the use of PPE in the houses. And at the time, at the very beginning of the pandemic, we relied on that more. But actually, as we moved through, we relied on it less. It was a wee bit different in our houses where we have children with complex needs, because there are children who have life-shortening conditions and children with underlying health conditions. So our reliance on PPE in those circumstances was quite different. But we risk assessed those situations really carefully, and the situations in the children's house. And we took the views of the children into consideration. And what we found early on was that wherever we were, if we were using masks, the children needed to see us speaking to them. They were finding it really difficult if we had a face covering on that they couldn't see through. So we basically adjusted how we use PPE to make sure that we were trying to be as sympathetic and empathetic to the children as possible. We had similar challenges to other organisations in actually accessing PPE and hand sanitizer, etc. In the first weeks of the pandemic. I think there was a worldwide scramble for sanitizer. We linked into organisations, alcohol producers who couldn't sell alcohol because of lockdown, who basically flipped their production into the production of hand sanitizers. So we relied on donations for that. And then we linked into the supply chain for PPE as required. So we never ran out of PPE. We always had an adequate amount of that, but it was sometimes difficult to source. And there was quite a lot of stories about things being delivered to people's houses and then trying to get it out to services within a very short time frame. But we never actually ran out of PPE.
You mentioned there that you sought the views of children, and particularly in relation to face masks and seeing adults speak. I wondered, did you seek the views of staff, and what were their views as to whether or not it was appropriate?
So we had a very clear policy. Our staff come to work and they all come from different situations. So we were very aware of the fact that staff could be living in families where family members were vulnerable. So we basically took that into consideration, and if they wanted to either wear masks or needed masks to be worn by other people, we would be fully supportive of that, because we were really clear about it wasn't just that bubble, if you like, of the children's house. It was reducing the footfall around that children's house, but always understanding that we could not legislate for everything and that risks still occurred, and we needed to make the risk assessment of that wider context that our staff were coming from.
You go on at paragraph 82 of your statement to discuss the impact, particularly on the children you support who have disabilities. And you say that this is the area where we had the biggest level of concern for the longest time. What do you mean by that?
So that was really in respect. There was a number of issues at play. So first and foremost, we felt that there wasn't enough attention paid to the specific needs of children who had underlying health conditions and how that might impact on their experience of COVID if they were to become infected by COVID. And that remains a concern for me, that the state was not explicit or quick enough to recognise that and to respond to that. So we were then, and we as I've said earlier, we provide short breaks to children with complex needs, as well as accommodating a small number of children as well. So we had immediate issues in our houses where we had children with immunosuppression, and we needed to work really closely with public health in local situations to try to get a coherent response to the questions that we were asking. That, in the main, went okay, but there were situations where we got contradictory advice as well from public health professionals. In terms of that larger group of children who we looked after on an intermittent basis when they came for short breaks, there was a number of areas of concern that we had for those families, because there were different responses across the country to whether short breaks for children took place. So there was an immediate issue for us in terms of making sure that our staff felt supported. So they may not be supporting families in the houses, but it was about giving permission to families to keep in touch with families where short breaks had been suspended. Because what we know is that if parents are caring for children with complex disabilities, that is at times a very stressful situation. Short breaks are provided to alleviate stress within families and to offer respite, not a word I use habitually, but to offer respite to the child and to the family in order that the batteries can be recharged. So the pandemic brought different challenges for those families, and we wanted to make sure that we were as connected into those families as we could. But there were periods where short breaks were suspended, where they were reduced by local authorities, and where we had to support families in quite a different way. That was the area of our operation that was probably the most affected by COVID in terms of the reduction in service that we were able to provide. But we didn't reduce our staff, so we took the decision that we would pay for the fact that our staff were supporting families in a different way. Some local authorities were very good and still paid us for the contracts that we were trying to deliver, but couldn't because of COVID. But again, that was a bit of a mixed picture. So we used a significant amount of our own money to make sure that we didn't have to make people redundant or furlough people, and we shifted how we worked with those families in that period to make sure that we didn't lose contact.
When you say it was mixed, were there some local authorities where short breaks continued to be allowed throughout?
Yes, so and that would be, again, that would be risk assessed. So families that were really stressed or had some significant difficulties, then we couldn't look after the same number of children in the houses, so you would reduce the number of children that you could have on an overnight basis, and it would all be reliant on a risk assessment, testing, use of PPE, etc. But yeah, there was short breaks still took place in some areas, yes.
And in some areas there was just simply a blanket ban?
For a period, but that itself did not last for a long period of time. We worked with the local authorities to create those safe environments for children, because they could see the impact of the supports being withdrawn on families, and they didn't want it to get to absolute crisis either.
You say at paragraph 86 that within some local authorities you saw planning which didn't seem to register the vulnerability of these groups of disabled children and their families. I wonder if you can explain what you mean by that.
So I think traditionally children affected by disability have been poorly resourced, generally, and the pandemic probably brought that to the fore in terms of the lack of attention to detail in relation to supporting families. So, and I think that inconsistent response across local authorities shone a light into the fact that there was very different practice in place in Scotland, and really so two families could have this broadly similar set of circumstances but be offered very different support, if any, by local authorities, and I think the pandemic brought that to the fore for us. So there were local authorities that were following best practice and trying to maximise the support that families got, but there were others where there was a more inconsistent, and at times it felt chaotic response, because people, you could sense that people were, they were working with a situation that was terribly new to them, and they were trying to navigate huge levels of uncertainty. And you know, within children's services, there wasn't the response that should have been in place around children affected by disability.
I think you say in your statement that you perhaps felt the focus was targeted around those who were on the child protection register, rather than children who had disabilities who perhaps weren't similarly.
So there would be an element of that, but even those children on the child protection register, I think that we were certainly supporting those families too. I think the basic problem for all of us is that it remained an adult response to an issue that affected the whole population, and there wasn't enough attention paid to the impact on the child population more generally. You can see that in schools, you can see it in terms of children with complex needs, you can see it in children in children's houses. They weren't really part of the conversation.
You go on to say that, in your view, the impact of COVID has been longer standing for particularly groups of children and young adults with disability. And you say that the care crisis continues to impact access to support services and the longer term impact to the provision of daytime care centres. Is that something that your organisation has had experience of, the longer term impact?
So one of the issues has been the fact that we went from the COVID pandemic straight into a cost of living crisis and a situation of public sector funding that became even tighter than it was before COVID. So it's difficult to say whether the resultant pressures on local authority budgets, specifically around children affected by disability, is a result of COVID or is has the consequential impact. But the fact is that, or the consequential impact of the budget cuts, etc. But the fact is that we have not, in some circumstances, not all, but in some circumstances, got back to the level of provision of short break support and support to children affected by disability that we had before COVID. And that is made more complicated by the challenges that local authorities are facing around budgets, undoubtedly. But I think that is also true in education. When you look at this, the support for learning in education, the statistics are quite clear about the reduction in support assistance, specifically around children with additional support needs. There is an issue that has to be addressed by this country. It's not all a result of the COVID pandemic, but actually the COVID pandemic allowed an interruption to an overall plan, and we now see a detrimental consequential impact of reduced investment for those children affected by disability.
I know, I was just saying I understand that.
You go on to discuss the impact just on the vulnerable families that your service saw generally. And an interesting observation which I wanted to pick up with you was at paragraph 67, you say some families liked not having to cope with the number of organisations that they were keeping in touch with. Can you explain that concept?
So this was more to do with families in the community and families who were living in perceived high-risk situations with their children. And there would be, at times, care plans in place between the local authority, the health authorities and the not-for-profit sector if we were involved with families, around visits, around making sure that families were seen, children were seen, and And there was a perception amongst some families, and I recognise this as a social worker, where people felt they were being monitored but not helped. And the monitoring for them felt stressful, felt unhelpful. And actually stepping back from that and giving the families a wee bit more control over how agencies spoke to them, what that felt like for some family was beneficial. They found that they were less stressed, they were actually able to function more positively as a family. But for other families, the reverse is true. They felt really badly impacted by the removal of support and the disconnection from services that they had become reliant on. So it was a mixed picture, but I think the reason I mentioned it is because we can't assume that the change in the state provision and the third sector provision to families had the same effect on all of the families, because people experienced it differently.
You've got about 10 minutes, Ms. Traynor.
I'm grateful. I wondered, one of the most unique aspects of the service that you provide is the advocacy service which you provide to unaccompanied asylum-seeking children.
Yes.
And I think you say within your statement that you work with around 800 children who are unaccompanied asylum seekers.
Yes.
Are you able to tell us what needs that group have that are perhaps distinct from other children and young people?
So the children that we work with come to Scotland from whole host of countries across the globe, and their circumstances vary, but we have a high level of children who come to us who have been trafficked, either for sexual exploitation or for economic exploitation. We have children who come to us from war zones and who have fled and are seeking asylum as a consequence of that. And our job within our guardianship service, which is a really well recognised service not just in the UK but across Europe, is that we provide advocacy to make sure that when those children come to Scotland, their rights are respected and their rights are met by the people who are looking after them. The children themselves have what's described as looked after status, so they have the same status, if you like, in terms of entitlement as the Indigenous child population that are in the care of the state. So they are accommodated by the state. So we provide advocacy to make sure their rights are realised. We provide support for them in the asylum system. All of our guardians are trained immigration officers to level 2 immigration qualifications. And we work with them around their education, around their mental health. But they come to us with a broad range of experiences. What I would say is that as a general group of children, they are highly motivated to learn when they come here. There are some issues around how they access education, some significant issues about how they access education. But they don't tend to, as a population of children, hard to generalise, but they don't tend to get in trouble with the law. So they are very, despite their challenges psychologically and emotionally, they want to come and make a better life for themselves when they get here. So at the moment there's over 800 young people that we're supporting. I think at the beginning of the pandemic that figure was about 450. So we've seen a real increase in the number of unaccompanied young people coming to Scotland. So that's the type of support that we provide.
I think you go on to discuss the particular support that you provided during the pandemic, which was relative to the situation that they were in. And you say that at paragraph 99 that these young people were having difficulty accessing and understanding the public health information and that you needed to provide translated guidance for them. So you put together that translated guidance
Yes.
in order to help them understand what was going on.
Yes. So we were working with a situation where there was some fear amongst that population of young people around authorities. But yes, there were situations where they were all, not all, but a significant number of them were in the early stages of learning English, so they just couldn't understand the guidance as it came out. So we had to do a lot of work to make sure that the guidance was translated for them. So we use interpreters on a regular basis. So we got them to do videos of advice from the guidance that we shared with our young people. Later on in the pandemic, when we were able to, there was a lot of hesitation around vaccines and vaccination programmes, and some of that was cultural and some of it was just young people feeling overwhelmed. So we worked with them to do vaccination clinics to make sure that they could access whatever supports they needed in terms of the pandemic. And we also made sure that our Allies service, which is our mental health service for young people, in that group of young folk, basically pivoted, went online and made sure that those sessions were still available to our young people during the pandemic, because as you could probably understand, a lot of these young people come to us with significant emotional and psychological difficulties.
Ms. Traynor, I should apologise. You've got more time than I thought. I do apologise.
I was looking at the clock.
You've still got about 20 minutes.
Thank you.
So I do apologise.
You go on to narrate your view, and I think we've already touched on it, on generally the Scottish Government messaging. And quite fairly you say, I think at paragraph 105, that you think generally the messaging was reassuring. But then you go on to say that you think decisions which are being taken around guidance caused confusion, and when you're confused, your emotional well-being can be affected. Is that reflective about, as to the children and young people that you were supporting, and perhaps the confusion having an impact on their well-being?
Actually, that statement was more about the impact on our staff. Because what we had, and I experienced this as well. You know, we were all new to this. We had not made plans for a global pandemic in our contingency planning, so we were all learning on the hoof. And as a chief executive, when you look across your organisation and you think of the number of people that ultimately you're responsible for, that can be quite overwhelming. And I'm sure you've heard many people say that to you in these evidence sessions. So that was much more to do with, you know, my job as a chief executive was to ensure that our people, our staff, felt supported, felt held, felt that they could operate in a space where they could care safely for our children and our families, and that their own emotional well-being was not being impacted as a consequence of that. So my comment about that was about staff. So when we dealt with changes in guidance, not so much changes, but contradictory guidance, we usually got that from our frontline staff. It was usually about whether PPE was necessary or whether it was not. It was about whether the children could see parents or whether they could not. And what that did was it did foster a level of uncertainty in our staff. So we then needed, as an organisation, to link in with those people in public health or in local authorities to make sure that we were getting consistent messaging out to staff. But we were also really clear in our messages to staff internally. So for those, one of the things that changed was the definition of underlying health conditions, and which staff might need to, we called it cocooning in the first instance, but who needed to socially isolate because of underlying health conditions. That was a changing picture. So we needed to go out and say, the bottom line is, if you have an underlying health condition and you cannot come to your work, then we understand that, we recognise that, and we will not, you will still be paid. We will not count your absence as illness in the usual sense, so it won't be used as in terms of your absence management procedures, and you will receive 100% of your salary. So, and that was about saying to our work, we're a charity that supports children living in poverty. Our staff in social care are not paid, big wages. They rely on their wages to survive month to month. So part of that was just about giving really clear messages to our staff that we would support them emotionally, practically, and psychologically, because it was difficult for everybody.
You talk about one of the things which was perhaps unhelpful in terms of giving a message to staff as being the COVID bonus payment and that being an issue. Can you tell us what the issue was?
This caused such difficulties for social care. So there was an announcement that the Scottish Government would pay a bonus payment, an acknowledgement, and it was a classic example of a kindness being applied, but being applied unfairly, and it very quickly becoming something that became controversial. So only some of our staff, despite many of them working in quite difficult situations, qualified for that bonus payment. So we were in a situation where we needed to look at who was to be paid the bonus payment from Scottish Government and how we dealt with the fallout of that. Now, I would have to say we probably weren't as impacted in terms of numbers as some other organisations, but we certainly thought that there could have been a fairer way of applying that bonus payment to the social care sector. And I think that, again, what it did was it displayed a lack of understanding of what was actually happening on the ground and who was involved in supporting families and children during that pandemic. And it was a much bigger population of social care staff than adult social care workers.
Or put another way, a policy implemented without being properly thought through.
Your words, Lord.
My words, indeed.
Yes.
But do you agree with them?
Yes.
Thank you.
Another area which you raise, I think, at paragraph 121, in terms of staff concern, is that there was a concern about the lack of social work presence and visiting to families, including families who were under statutory child protection measures, and that led to you completing reports based on your assessments that then social workers utilised to send to the children's panel because they hadn't had that contact with the family as your workers had.
Yes.
I wonder, is that a concern about local authorities effectively using you for something which is within their statutory remit? Yes.
So we are obviously part of care planning for children if we're involved in a family where there's a child subject to supervision requirements. So it would not be unusual for us to provide a report to a children's hearing at the time of annual review or where there's been a requested review. But where this was different was that because in some areas social workers worked from home and were not visiting families on a regular basis, they couldn't write the reports. So there was a reliance on the information that we were collating for the family. And I use that example because it came up a number of times during the pandemic. And I suppose the question I was left with actually was, we found ways of maintaining contact with families that did not increase risk to families. And at times it felt like some parts of the public sector, not all local authorities, but some local authorities took such a risk-averse approach to this that it impacted on service delivery to the most vulnerable families. And I think that's something that is worthy of some discussion, further discussion, because again, if we look forward, if we plan for around another pandemic, we need to address these questions and understand what we should expect in terms of support from the local authority areas. Now, I'm not saying if that happened in every local authority area, it didn't. But the fact that it was a different experience depending on local authorities rather than a consistent approach is an issue in itself in a global pandemic context.
When you say their risk-averse approach, I presume you mean risk-averse in terms of placing their staff in a situation of risk, but perhaps not necessarily applying that risk assessment to the families who they're supporting.
Yes, it was not a holistic risk assessment that was taking place, in our view.
Towards the end of your statement, you really reflect on the pandemic period and the changes that it's caused your organisation to make. And you say you've learned a lot from COVID, and there's things that you'll keep doing in relation to residential care particularly. What are the things that you will keep doing?
So I think the use of technology is one area where we are exploring how we can continue to use technology for good, if you like. That brings lots of challenges, as you probably appreciate, in terms of the development of AI and various other things where we need to risk assess how we use that technology, but we certainly will use that. Just from an organisation perspective, we're a national charity. I spent most of my life driving from one end of Scotland to the other pre-pandemic, and I still obviously have to do some of that, but I certainly don't do it to the same extent. So we've taken a lot of our internal meetings online, and we won't ever return to the same level of face-to-face meetings, albeit some of that is important. In terms of services to families, we do adopt a relational approach. So, albeit we pivoted and went online, and we used technology, and we still will use that in certain circumstances. We also understand the real value of sitting alongside, literally sitting alongside families and exploring with them what things they think they need to change in their family situation. So we obviously have increased our direct contact with families and communities, and that will be maintained.
One of the things you identify, I think, as effectively having a kind of kickstart and a ramp up, I think you say, is the Urgent Assistance Fund and basically a cash first approach to helping vulnerable families. And there's a sense, I think, that your view is that should continue.
Yes, and we have continued that. What we also did at the beginning of the pandemic, it's an urgent assistance fund, and I said, well, actually, if it's urgent, then it's urgent. So if we get a referral in asking for a grant, and it's all grants that we deal with, it's not loans or anything like that, then at the point of receipt of that grant, we need to ensure that the money is in the hands of the family within 72 hours. Because one of the other issues that we see is that in some other funds, like the Scottish Welfare Fund, is a much longer lead-in time, it's a much longer waiting time to actually get the support if it's granted. So one of the things that we will continue to do, and have continued to do, is use that 72-hour window to make sure that we get the support to families in the shape that they need it within 72 hours of us being handed the application. And we've managed to meet those targets.
Effectively cutting down, I suppose, the kind of processes and the red tape and just getting the help out there when it's needed. Well,
we took everything online. We've now got electronic systems that support the application process. So, yeah, having an electronic system has allowed us to speed up the process and get the money out the door. And I just keep reminding people it's an urgent assistance fund, urgency. Get it back to families within 72 hours. They need it for food, they need it for their bills. Get it to them at the point where they need it.
There's a sense from your statement generally that your view is that the third sector was really able to adapt and to move quickly in a way that perhaps the public sector wasn't.
Yes, I think the third sector played a really important role, especially around the beginning of the pandemic, where we were pivoting and trying to make sure that we stayed close to families. I think there's probably rich learning in the public sector because, at the point where we were doing our appeal around our urgent assistance fund, I would have to say that the Scottish Government responded very quickly to our appeals to get money out to families. They were considering the same dilemma as we were considering about how do we make sure support gets to the right families at the right time. We had a national distribution mechanism that they didn't have, so they supported us financially to do that. And I think there was a lot of talk in the very early months of the pandemic about how that collaboration between public and not-for-profit sectors and families actually was something that was really positive, and that we shouldn't forget how readily some areas became much more flexible and more flight of foot. And I think at some point we may have forgotten that conversation about how we remained in that space, because I think sadly not as much of that good learning has been retained post the pandemic emergency. And we see some And maybe this is to do with the current situation in terms of the fiscal issues that we're facing, but we certainly see a less flexible approach from government in relation to some of those conversations that would have taken place during the COVID pandemic, despite the cost of living crisis and how people are experiencing that.
Those are all the questions that I have for you, but I'm mindful you've given up your time to be here today, and I wonder if there's anything which we haven't covered which you would like to raise.
No, I don't think so.
Thank you very much.
Thank you.
Yes, indeed, Ms. Kelly. I'm very grateful. Thank you very much. Right, 11:15.
Yes, thank you.
Thank you. Very good. Good morning, Mr. Caskey. Good morning, Ms. Loucks.
Good morning.
When you're ready, Mr. Caskey.
Thank you very much. Would you tell the inquiry your full name, please? How would we refer to you?
You can refer to me as Nancy Loucks or as Professor Loucks.
Professor Loucks. Okay. You're here in your capacity as?
As Chief Executive of Families Outside.
And can you tell us a little bit about Families Outside?
So Families Outside is a national Scottish charity that works exclusively on behalf of children and families affected by imprisonment. So we have staff based all around Scotland to provide locally based support, as well as running a national helpline, and we provide policy input and training input as well.
Okay. Can I say at the beginning, there's a stenographer who's trying to keep up. Both of us need to
I do speak very
slow.
quickly, so
Yes,
I will try to avoid that, yes.
You've provided us with a detailed witness statement, which for the purposes of the record I can say is SCI WT 0453501. Do you recall providing that statement?
I do.
Is its content true?
It is.
And do you wish to adopt that as part of your evidence to Lord Brailsford today?
Yes, please.
Great. I've been through the statement in some detail, and can I try to summarise not what the function of the organisation is, but how you do it, which is you have a helpline, which is the most common way that people contact you, and then you have regional teams who carry out follow-up work.
Yes. Although they can receive referrals directly as well, yes.
Yeah. Do you have a copy of your statement to hand?
I do, yes.
You provide a more detailed summary of the work that you carry out at paragraph 10. Is that correct?
Yes.
And then at paragraph 13, you provide 7 bullet points detailing what it is Families Outside do.
Yes, that's correct.
At paragraph 17, you talk about another aspect of Families Outside work, which is rather than dealing with individuals personally affected, you're dealing with other groups. Tell us a bit about that work by Families Outside.
So we provide, sorry, do I need to turn this on, or is that?
That's fine.
Okay, that's fine. So we provide training to individuals who are likely to have contact with families themselves, so that it enables a wider network of support for families. So that includes training for prison staff, for teachers, health professionals, social workers, and so on. So again, it's just make sure that people have an awareness of how they can support families affected by imprisonment within their own remits.
Paragraph 16, you give percentage figures for the regional family support. I'll ask about the helpline in a moment, but you give figures there. Can you just give us an indication of what those figures are for the types of contact that the regional teams have?
Yeah, that's fine. So we support families with whatever they come to us with. The most commonly, this includes emotional support, the types of support for about how to visit, how to maintain contact with the person in prison. Often they'll be concerned about the person in prison, worried about their health and well-being, for example. But they're also worried about their own children, and they ask us for information about the prison. But they can come to us for any range of reasons, and it's usually more than one reason.
Okay. At paragraph 19, you begin to talk, albeit briefly, about the organisation structure. I understand it's a charity, a registered charity.
Yes.
And you have a board of trustees. In paragraph 19, you talk about trustees becoming nervous at the time of lockdown. Tell me a bit about that.
Yeah, well, as was the case with everyone in lockdown, it was people weren't sure what to expect. They weren't sure what that would mean for us financially. They knew it would mean a change for how we operated, how we provided support as an organisation, and what that would mean for the families we were supporting. So what they did was they actually organised. The board usually meets quarterly, but they arranged to meet monthly until we had a better idea of what lockdown would mean for the families that we were supporting and for our staff.
And presumably those meetings would be online.
They were online at that time, yes. Well, we shifted to online. They were always in person before.
Okay. You talk at paragraph 20 about the organisation facing cuts.
Yes.
Again, tell me about that, please.
That was a concern about what, because the financial impact was very uncertain. We didn't know what to expect, and the board was concerned about what it would mean for our organisation. So they actually asked me to cut the budget of the organisation by 45%. Now, 85% of our costs are staff salaries, so that would mean losing staff, which we've never had to do before. We'd never had any kind of redundancy process before. So it was quite a change for our organisation, and it reflected the anxiousness of the board in keeping the organisation afloat through the pandemic.
Okay. I don't think you've provided numbers in relation to your budget. Can you give me an idea of the budget around about the time of the pandemic?
Yeah, so during the pandemic, in the 2020-2021 financial year, our budget was 1.2 million. At that point, about 45% came from statutory sources and about 46% from charitable trusts, so it was a fairly even balance.
Now, can I pause you there? I'll ask you to give the subsequent figures in a moment. Yeah. But at that stage, you were being told you were faced with cuts in funding. Was that from statutory agencies or charitable trusts?
It was more about a concern that we would be facing cuts from both sources. We weren't sure what to expect. And it was the reality that as a charity, we often enter a new financial year in deficit and have to cover those costs as the year progresses. So it was a concern about whether we would still be able to raise those funds in the same way that we had in the past.
Okay, now you gave us figures for the year before the pandemic. At the time when the pandemic kicked in, were you able to access unexpected funds, if I can put it that way?
Yes, so a number of charitable trusts in particular had COVID-specific funds, so they introduced emergency funds that we were able to apply for and access. So we were able to increase our input from charitable trusts quite considerably over the next couple of years.
And I think you provide a figure for funding that you received specifically because of COVID.
Yes.
Can you tell me how much
so
the organisation obtained?
Yeah, so as I said, when the pandemic started, our budget was about 1.2 million. The year after that, it was 1.24 and increased our proportion of funding from charitable trusts up to 57%. And the following year after that, we went up to 1.34 million, which increased, again, the proportion of funding from charitable trusts to about 58%. So it was, again, it shifted the proportion of funds we received. So
you weren't receiving such a significant proportion from statutory organisations, but were from charitable trusts. Yes. Which statutory organisations provide the significant parts of your funding?
So we have central government funding from Scottish Government Community Justice and from Scottish Government Children and Families. We also receive a small proportion of funding from health, but that's minimal compared to the other two.
And simply, can you tell me which charitable trusts provide you with significant funding?
Many, many. So at that time, the Tudor Trust was a major funder. The Robertson Trust was another funder. Porticus was another one. I'm trying to go through my head. We have many that we access, but those are the bigger ones. Yes.
Okay. Now, around about you also. Families outside also, and the word which is used in your statement at paragraph 25 is hosts.
Yes.
hosts the INCCIP. Tell us a bit about that organisation.
Yeah, so INCIP is an international network of organisations that do similar work to what Families Outside does, the organisations that have an interest in supporting children when a parent goes to prison, specifically. So that organisation was actually founded by a colleague in Uganda, but Scotland was a much safer place, more stable place to host the organisation. So it's registered in Scotland at the Families Outside address as a Scottish charity.
Okay. I'll ask you about international contacts later on, because there's something there which is quite important. But at the time that COVID was happening, or about to happen, coincidentally, there were changes within the organisation in terms of premises and so on.
Yes.
Can you tell us about that?
So when I started at Families Outside in 2008, there were 4 of us, and we moved into a new office at that point that was fine for 4 people. By the time the pandemic came about, there were 19 people working out of the same space, as well as an office in Glasgow and staff in other parts of the country. So we needed a bigger premises. So we looked around for quite some time, found a lovely place, moved in December 2019, committed to a 10-year lease with a 5-year break, which meant we were able to be in it for 2 months before we had to move out, or had to vacate, I should say. We still had the office but couldn't use it and still had to pay full rent and full rates.
Okay, and but in the once lockdown ended, did you get benefit from the office?
We did. We would never have been able to move back into the smaller office space we had before, so it was really helpful to have the bigger premises for us to be able to bring staff back in, to be able to provide some kind of COVID-related precautions, such as kind of glass panels between desks and that sort of thing. So that was very helpful. Yeah.
Yeah. At paragraph 30, you talk about preparations for lockdown.
Yes.
And remote working. Can you just tell us a bit about that? Although I would indicate to you, we've heard a lot about agencies in the caring sector going online.
Yes.
Can you just tell us a bit about that?
Yes, so we could obviously see from the news internationally that we were likely to face a lockdown. Many of our staff worked remotely anyway in terms of not being based in the Edinburgh office, but all of our staff would travel out to see families and so on. So what we asked them to do was to prepare the families that they were already working with, that we might have to work remotely and support them by telephone or by video link. We didn't really use video link that much at that point, so it was mainly by telephone or by email. So they were able to prepare the families for that eventuality. The biggest change we had to make was in relation to the helpline, which was always based in an office at a central point, as much so the staff were there to provide support to each other, because some of the calls could be quite distressing. So we had to find out what technology could be used, how we could actually provide support for ongoing support and training for staff who are providing that service. So that was probably the biggest shift.
And obviously, well, I say obviously, I assume that staff were working from home, whereas previously they would have been working from the office. Is that correct?
Yes.
Did your staff face particular difficulties with the fact that they were at home and presumably they weren't necessarily in a confidential area? Yeah,
so it did vary. So I had previously worked from home and had a home-based office, so I was fine. However, I was very conscious that a number of my staff, especially if they had partners who were also working at home, that meant they were kind of vying for space. I had one member of staff who had toddlers running around while she was sitting in her living room with a laptop on her knees, just trying to conduct some element of work supporting families while she was already herself struggling. We had staff who lived on their own, who might be dealing with suicidal callers, for example, or people who are in distress for other reasons, that you really had no support and quite a lot of difficulty, I suppose, distinguishing between a workspace and a home space. So it was, I think, psychologically quite difficult for a lot of our staff to make that transition. To paragraph 34, you talk about introducing several supports for staff.
Again, can you tell us a bit about that?
Yeah, so we were able to provide home office equipment as best we could in terms of desks, in terms of chairs, making sure they actually had a good computer equipment so they could provide remote support and have remote access to the database, for example. We made sure that staff took time to look after themselves, whether it meant taking a walk or having what we called a staff well-being hour that we introduced.
Yeah, tell me about that. I haven't heard that from other.
Yeah, so it was just recognizing that. Yeah, it was recognizing that what they were doing was very difficult, and recognizing that they could take some time for themselves and not feel guilty about leaving their work. So they could take a walk, they could, do exercise, they could, just take a break away. So making sure they had a break away from the screen, so they could actually look after themselves, and that was really important. Some staff came up with quite creative ways of distinguishing between work time and home time, such as by lighting a candle at the start of the workday and blowing it out at the end of the day. So it's just making sure that they were able to support themselves and each other.
Paragraph 36, you talk about help that you obtained from the Tudor Trust.
Yes.
Can you tell us about that?
Yeah, that was lovely actually, because they set up a fund specifically for staff well-being, because some of the COVID funding was related to support for the families that we were working with, for example, but this was specifically recognising that staff would be under strain, and they provided a £2,000 staff well-being fund for us to use as we wished. So we asked the staff what they wanted, and of course everybody had different ideas about what would be helpful, so we ended up giving them a choice of vouchers that they could use to buy whatever they felt they would help them. So some of them bought walking boots, some of them bought craft kits, or special items for cookery. Some just resorted to kind of chocolate and alcohol. But it was making sure that they had something that helped them then get through and know that they were being cared for.
That's quite innovative, because we've heard quite a lot about different charities getting additional funding for their users, if I can put it that way.
Yeah.
I don't think I've seen others saying they got additional funding effectively to give the staff a gift.
It was really helpful to have that ring fenced, because we probably would have used it towards the support for the families we were working with, but it was recognising that there was an acknowledgement that our staff needed that help too.
And presumably that had a positive impact on the staff.
Yes. Yeah.
Okay. Paragraph 38, you talk about making 126 funding applications in 2021.
Yes.
Tell me a bit about the funding applications and what you got and so on.
Yeah. So to be honest, making that number of applications isn't that unusual. We did accelerate the process as much as we could, just because we recognised that funding could be more challenging. I think I said as a result of that, about a fifth of those were specifically for COVID-related costs. The applications were successful. I think of the 126, 9 were successful for 1 year, plus existing funders changed the timing of the grants to kind of front load it, for example. So a 3-year grant was turned into a 2-year grant to bring some of that funding forward. So it did help just sort of make sure that we had that. I don't want to say padding, because it wasn't really padding, but it was just making sure that we had enough to get by in the short term. I don't know if that answers your question.
It does. It does. I think you move on to start talking about your helpline. Now, your helpline is very important to the organisation. Just again, tell me a bit about the helpline and how it works.
So the helpline is the first port of call for most families who come to us. So most people find out about us online. They do an online search to find out what support is available. Over 3/4 of people come to the helpline through our website. And we can actually take actual telephone calls, but we can also accept contact by email, by text, by social media. We have a web chat that provides simultaneous translation into most modern languages, which is really helpful as well, depending on what suits the people to come to us. So we get about 2,500 contacts per year for that.
And how did that figure alter when lockdown happened?
Yeah, it went up dramatically, especially when once mobile telephones and video calls were introduced into prisons, which was about 5 months after lockdown started, we had a 245% increase in calls from families wanting to know how to make this work, how to maintain contact when visits had been stopped. So it was quite a dramatic increase.
Presumably, the SPS would put in place various security measures regarding the links between inside prison and outside prison. Were you involved in terms of overcoming those for family members?
Security measures in terms of the cessation of visits, or?
Well, it was the cessation of visits, but also in terms of ensuring, well, let's leave that for the moment. I'll come back to that. There's another way of getting there. Okay. At paragraph 41, you talk about 1 in 4 of the contacts to our helpline were from callers with a concern for someone in prison, and a 51% increase in calls from family members worried about the mental health of someone in prison. Yeah. There's also a couple of tables relating to the type of service that you were requiring. Can you just tell us about the changes which happened over time when the pandemic kicked in? Yeah.
So what we had was a situation where families who had previously been able to visit someone in prison and had been able to have fairly regular contact by telephone, but that wasn't possible anymore. They couldn't actually go and see for themselves how the person was doing. They had good reason to be concerned because, as with a pandemic, you obviously worry about the health of your loved ones, and with someone who is in prison in a confined space where they had very little control over their hygiene, their access to sanitizer, their access to PPE. The families had good reason to be concerned, and we know that the families were aware that the regime had changed so that people were locked in to their cells. They weren't going out to exercise and education in quite the same way they had been before. So families were worried about the mental health and well-being of family members, especially where mental health was often a problem before they went into prison. And families weren't able to see this for themselves, so we had a lot of questions from families about what was being done to support their family members. What they were hearing was that people were only allowed out for short periods of time out of the cell, and they had to choose between whether they wanted to wash or to use the phone or to make sure their laundry was done, that sort of thing. So it was, access to the telephone was more limited as well, certainly in those first few months. So we did have visibly increased concerns from families in relation to that.
I'll ask you about access to telephones in just a second, but you indicate that people were out for a very limited period. We heard evidence from the Scottish Prison Service last week that often people were only out for 30 minutes a day. Can you give us an idea from your knowledge and contacts what had to be squeezed into that 30 minutes?
Everything had to be squeezed into that. So that's where if they could use the telephone, that's where they would use the phone. If they could make sure that their laundry was done, they would do that. If they wanted to shower, they would have to do it then. Any questions they had, any contact they needed to make with prison staff was during that half hour. Everything had to be squeezed into that, so it was very rushed, it was very pressured, and people didn't often have time to do what they had to choose, had to prioritise what was the most important on that particular day as to what they would use.
And did they always choose contact with family?
Not always, no.
Would they frequently not do so?
They often, what we were hearing from families is that people were afraid to use the telephone as well, because again, it was a hall phone, a public phone shared between everybody, and if they were worried about contracting an illness, then they probably wouldn't want to use the phone. So
because the phone would be at their mouth and nose. Okay. In the witness statement, you quote some people some users of your service providing information. Could you read aloud paragraph 43, please?
Yeah. So paragraph 43 says, I am very grateful to the helpline at Families Outside for facilitating a compassionate call between my son and my mum last night. I'm hopeful that this will be repeated soon. I have to say that everything about the way she handled this task was exemplary. I could tell that she genuinely cared and was determined to achieve an outcome, which she did in a very short time frame.
You moved down, there's other quotations, but you moved down at paragraph 46 to say what people on the outside were concerned about for people on the inside. Can you just tell us about that?
Yes, so people were understandably worried about whether they were safe from COVID, whether they were likely to contract an illness, whether they were likely to be depressed or suicidal or isolated, because they were locked in so much of the time, 23 and a half hours. And it was also about how easily they could contact people outside where they had previously had visits. Those weren't happening anymore. In the case of the quote that I just read, that was a lady whose mum had gone into a nursing home and didn't have any access to her grandson, whom she wanted to be able to speak to. So it was trying to find a way that they could have that contact, but it did take quite a lot of work to make sure that people had contact with those that they needed. You
also talk about concern on the outside about movements in and out of prison as a cause for concern. Again, could you tell us about that? Yeah, so it's the reality that when you're in prison, you have very little control over what happens to you in terms of with the rest of the country in lockdown. Prisons were one of the few places where people were still moving in and out in terms of the population. You were still having people coming into prison, still having people released from prison, and the prison staff equally were coming in and out of prison on a daily basis. So there was that real live concern that there would be that transmission of illness would be more readily possible in that context. You explained to us earlier that quite a lot of the people who contact you do so after searching the web for information. Yes. And therefore, presumably, one of their sources when looking for you or someone like you would be the SPS website. Yes. In terms of the SPS website at that time, around the time that COVID was becoming an issue, did that provide information to families about what was happening and how they might make contact and concerns about family members? Yeah. Not at that time. We did work very closely with the SPS to make sure that there was information available, but it took several months to have any information available on their website that was focused on the public. So they did eventually develop a COVID-19 information page. I'm trying to remember the timing exactly, but it did take several months for that to be available for families to see. And in that initial stage, was there just nothing on the SPS website? No. Does that reflect why, do you think that reflects why your figures went up in terms of the helpline? I think it's probably one reason, yes. I think people will, when they're looking for information, they will look for it wherever they can find it. We did have very regular contact with the Scottish Prison Service, especially in the first few months, to try to make sure that there was information available. They were asking us the types of for information about what families were worried about and what information would be helpful. So we did work very closely together in terms of creating the website, in terms of preparing for mobile phones and video calls, which we'll presumably talk about later. We'll talk about video calls now. We'll talk about phones later. Yeah. You talk about video calls in paragraph 51. Tell me about your organisation's involvement in this establishment of video calls. Yes. As an organisation, we've been campaigning for video calls for quite a number of years prior to the pandemic. Not as a... About how many? Probably about 10 years before. Not as a replacement for in-person visits, but something that would provide some choice, some flexibility for family contact in addition to in-person visits. Sometimes you have families who aren't able to travel or families who live abroad, for example, and it just provides that method of contact that simply wouldn't be available otherwise.
So we did have examples of practice from Australia, from Canada, from Europe, and so on, about how this can work, and the types of models and methods and guidance and safeguards that could be used to have video calls in place.
And were you able to do that through your international contact group, as it were?
Yes, well, through INSIP, through the international network, but primarily through Children of Prisoners Europe, which is a more established, kind of longer-standing European network. We'd also had visitors from Australia coming to explore different methods of family contact, and they had introduced those in Australian prisons as well. Obviously, we've done a lot of research in the area in terms of what was happening in the US and Canada, and so we were able to draw on quite a number of sources around the world.
And so far as you're aware, prior to lockdown happening and prison visiting being stopped, were the SPS actively looking at video visits?
They were slowly looking at video visits. We'd certainly been in contact with them quite a number of years about the installation of video visits, and they had an IT working group looking specifically at how IT could be used in prisons. That was part of the discussion, but it was not something they had agreed on before, because they were concerned about the security implications and the risks involved. So it hadn't been, wasn't seriously on the table as an option.
How rapidly were they moving?
As I said, we'd been working on it for 10 years, so not very rapidly.
And before the lockdown, realistically, could you see light at the end of that tunnel, or was it a light that was switched on by COVID?
I'm always optimistic with these things, or I wouldn't be in this job, so it's just trying to have faith that these types of changes will come about eventually. There was no idea of timeline in relation to this, so COVID definitely accelerated the process, because suddenly it was urgent. So for us, that was very much a positive outcome of the pandemic, because I don't think it would have happened otherwise, not that quickly.
And do virtual visits still happen?
Yes.
You say some interesting things later in the statement, but I'll take them now as we're talking about video visits, about them not being taken up to the full extent available. Tell us a bit about that.
Yeah, so video calls were put into place in June of 2020, so it only took about 4 or 5 months, which was, in SPS terms, extremely fast. But what didn't happen as quickly was the uptake. We thought there would be much more use of the video calls than actually happened. They were never used, and still have, to this day, not been used to full capacity. So we actually did some work about why that might be the case. We did some research online and through the contacts that we had to find out what families' experiences were. So we looked at why they weren't using video calls, but then the SPS actually commissioned us to look at families' experiences of video calls, and we were able to combine the two projects and get an overview of how video calls were being used.
And tell us about that. What were the findings of that?
Yeah, so the findings were mainly that some of the families found the technology quite difficult. So it should have been quite straightforward, but they had issues where their ID wasn't being accepted for whatever reason, or they couldn't actually get online for some reason. We actually had a volunteer brought into families outside specifically to support them to make video calls, and that did help. But the kind of technical difficulties they had, again, I could go into more detail with the report in front of me, sorry about that. But they really struggled with the technology and the frustration of not being able to access it in the way that they would wish, recognizing that a lot of families would be accessing this through mobile phones. They might not have a huge amount of data or bandwidth to make it work properly.
And were you involved as an organisation in assisting people have the data?
We did. We worked with the SCVO, which is Scottish Council of Voluntary Organisations, had a project called the Connecting Scotland project, which we were part of in terms of helping families with providing them with tablets, for example, or making sure they had the network connection that they needed. We didn't actually manage to support that many families with that. I think there were restrictions on how IT could be used, and sometimes it wasn't so much about having the equipment as it was about having the internet access that they needed.
And did that prove to be an insurmountable obstacle?
It's not insurmountable. It just can be quite difficult in making sure that families have have the internet access that they need, in terms of making sure that's consistently available as well, because you can provide them with, for example, we were providing the little dongles, the kind of data pen things for families, but that would work when you paid for it for the first year, for example, but then how do you sustain that beyond the initial period that you've paid for it, when families are often struggling financially anyway? That might not be the first priority.
I'm going to ask you about financial struggles in a moment. The next thing which you talk about are regional support, and so you have your helpline, and then you have regional support, which is effectively outreach work. Is that correct? And you provide tables at paragraphs 56 and 58, but fortunately for those of us who don't like tables, at paragraph 57 you've provided an explanation of what you take from the table.
Yes.
Can you just tell us about 57?
Yeah. So basically we had a number of people who self-refer for support. In non-lockdown conditions, we would normally be receiving referrals from prison staff, from prison visitor centres, from schools, from social work teams, and so on. But what we saw was an increase in people referring themselves because they weren't at school or they weren't, visiting prisons and so on. So that there was a real shift in where the referrals came from and how people accessed the support that we provided in their local communities. So
I'm just looking at table 1. I'll just take some extreme examples. You had, in terms of self-referral, in 2019, 66% were self-referred, and that went up to 80% the following year. Was that because the alternative sources of referral disappeared?
They reduced. They didn't disappear completely, but certainly contact with prison staff and prison visitor centres dropped way down, especially prison staff directly. Yes, so the types of referrals that we received did shift.
And then you've carried out research on how families heard about your organisation, and you talk about that in paragraph 59. Again, can you summarise that for us?
Yeah. Again, it just shows that it did shift. So we did see different patterns, I suppose, pre-COVID and during lockdown. So again, people finding out about us more online rather than directly from prison staff or from schools or from social workers and so on, because they simply weren't having that same contact with those other professionals that they had in the past.
Okay. I'm going to move on to paragraph 63. And support for staff. Now, I'm going to say something which I would ask that you don't take offence at, right? Were you not to say that your staff did very well, you would be the first chief executive from any charitable organisation to appear before the inquiry to make that statement. I think we can take it as read from what's in your statement that you say the staff did very well.
Yeah. Okay.
If we go over to, just to give us an idea about regional family support, if we have a look at paragraph 67. So you're carrying out outreach work with families who have a person in prison. In 2019-20, the average minutes per family member were 235, and then the next year, pandemic year, it was 593. So it significantly more than doubled, almost trebled.
Yes.
Tell us about the change in work style of your regional teams.
Yeah. So many of the families that people were supporting during lockdown were people they had started to support before the lockdown conditions. We were receiving lower numbers of referrals from other professionals, as I've mentioned already. So we had a smaller number of families that we were working with, but we were working with them more intensely, often because their concerns were more extreme at that time, particularly in relation to concern about people in prison, about the loss of contact, about how to support children who were dealing with the experience of loss of contact with a family member, but also loss of contact with their friends and school and so on. So, and some of the families we were supporting, they often have quite a variety of needs. As an example, there was a lady who was contacting us about how to support her son who was autistic and had lost contact with his dad and didn't understand why, so he actually started self-harming, and it was just trying to, recognize how we can actually support families with what are extremely difficult and intensive needs from a distance, which was, did require more time by telephone and email and so on than we could possibly
Without betraying any confidence or confidential material.
Yeah.
What steps were taken in relation to that boy?
I wouldn't have the detail of the specific steps, but we often do access support from other organisations as well in terms of specific types of support, but our staff are very experienced in certainly in terms of supporting parents and carers in working with children.
Did you personally become involved in any cases where it was felt that intervention from the Chief Executive would be helpful?
I tend not to become personally involved as much because we've done exercises with boundaries and things before, and I'm really, really bad at boundaries. My staff are much more efficient and much more expert in this particular type of support. I did provide support to one family in particular, just because I had contact with them before, a family member who'd actually worked closely with the board in the past. She reached out to me personally, and her evidence is actually included in one of the appendices to the written statement, just because her son was in prison and was able to provide a direct comparison between what things were like before and after lockdown. Okay.
I was going to ask you a bit more about that, but we're getting close to the restriction order, so I'll not do that. You talk about staffing. And at 77, you talk about losing some staff. Tell me about that. I mean, one of the things which we've heard is that people working in your sector, if I can put it that way, some people burned out and looked for changes. So take that as read, because it's in your statement. Tell us a bit more about that.
Yeah, so we have always had a very stable staff team. I say always, I say pre-pandemic we had a very stable staff team, and although we had grown from 4 members of staff to I think 33 members of staff at the start of lockdown, still small for a national organisation, but a lot bigger than we used to be. And we tended to keep our staff. We had very low turnover, but that changed mid-pandemic where, as I mentioned before, the board got quite anxious and we had a redundancy process for the first time ever. And that was in June of 2021, and from June 2021 through the end of the financial year, we lost a third of our staff team, which is quite a big change, and all for very different reasons. We lost 2 through the redundancy process, but then we had some who shifted in sector completely. One wanted to work in wildlife and waterways, people who didn't want to return to an office-based setting or leave the home-based working. And they weren't ready to come back. People who were headhunted by other organisations who started hiring again when
third sector organisations?
Yes, not just third sector. I'm not blaming just them, but we did lose some excellent members of staff because other organisations wanted them. I'm trying to be flattered, but it was not easy. So it was quite a big change for us, and having to train staff when we were still not fully, back in the office. That was difficult because there was, we usually rely on shadowing as a big part of our training, and that simply wasn't possible for the first couple of years.
So the transition, once you were in a position to replace those staff, the training of them was particularly difficult.
Training was difficult. Recruitment was incredibly difficult because there were so many people looking for work at the same time. So it was very much an employees market. So it took much longer to recruit, months to recruit staff than compared to how it had been in the past. And staff were able to demand much higher salaries than they had in the past, which again, as a third sector organisation, puts quite a lot of pressure on our organisation.
And presumably that has an impact on the organisation in that if you're advertising a particular role and you have to give an increased salary to that person, that has an impact on those who are not getting the increase.
Yes.
How was that managed?
As well as it could be, but especially with all of our staff have kind of a pay scale that they go to. When normally we would recruit people at the basic rate, and then their salaries would go up as they became more experienced in that role. What it meant was that people were coming in and saying they wanted a higher salary, so they would start somewhere in the middle or even at the top of that scale, which meant there was no room for manoeuvre once they'd reached the top of that scale. So that was causing some longer term problems as well.
You then move on to talk about prison visitor centres. And as I understand it, Families Outside don't run a specific prison visitor centre.
That's correct.
Can you explain your role in relation to prison visitor centres?
So as the only national organisation that does this work, we provide an oversight and support to the organisations that run prison visitor centres. We have several decades of expertise in this area, so we were able to provide support to organisations that hadn't necessarily worked specifically with this client group before. So we provide, for example, coordination between the managers of the different prison visitor centres to make sure that we can have a basic standard of support at each centre. Every centre is a bit different. Every prison is a bit different. So it's making sure that visitors could have a basic standard of support to expect every time they went to visit someone.
Okay, and in paragraph 82, you talk about video visits, and you talk about the advantages and disadvantages of that. Now, obviously, a advantage is that there is at least some form of contact between families and individuals. The disadvantage is it's not in the flesh. But there are other disadvantages that you talk about here. Can you tell us about that?
Yes, I'm trying to remember what I said now. Some of it was that the risk is that the video calls will be used to replace in-person visits. The prison service was very clear that that was not the plan, that was not the intent. What we're seeing now, however, is a shift in interpretation and in understanding, I suppose, in how video calls are used. That video calls are now counted in some prisons as part of the normal visits entitlement. We're able to contest that because, again, it was very clear within the prison service when these calls were introduced that should never replace an in-person visit, but it does take some work sometimes to make sure that is remembered. We also have, what's interesting about the video calls as well, especially in relation to prison visitor centres, is that our coordination of that meant that we could actually introduce facilities for video calls in the prison visitor centres, so that if they couldn't access video calls from home, they could actually do it from a prison visitor centre. That was really helpful, for example, for people who might live in the Highlands or something, but have a family member in a prison that's quite a distance away. So, Pullman would have young people in it, or one of the women's prisons where they weren't able to access them from closer. So that was really helpful to have those facilities, I suppose, available in the prison visitor centres. And
when virtual visits are happening, where are the prisoners when that's happening?
They have specific booths in the main visits hall. In most cases, that's my understanding. I've seen it. All of the ones I've seen are in the main prison visits hall. So they have a booth that they can use for that. So it's slightly quieter, but they're still in part of the main visits area.
Now you talk about your own follow-up work. Going online much more. And then you talk at paragraph 83 of other mechanisms apart from online. Tell us a bit about that.
So the staff really felt they needed to be creative in terms of how they supported families, especially as lockdown conditions varied quite a lot. So it might be in a lockdown and then out of it and then back in it again. So they were trying to find ways that they could meet directly with families and build those relationships without actually having the same contact that they would have had before. So walk and talk meetings became very popular, or sitting in people's gardens, or one of our staff members actually got a family to become part of a community gardening project, which meant they could all meet and speak together outdoors, and she could work alongside them to provide that support. So they were, I'm not allowed to say how wonderful my staff team is, but they were very good at making sure they could make things as positive as possible for families, recognizing that some families, I remember one lady that hadn't actually spoken to anyone other than by telephone for several months. So it's just recognizing that need for contact and reduced isolation.
You talk about the usefulness of the contact made through visiting centres with the organisation, because you were able to do practical things for the families.
Yeah.
I'm looking in particular at paragraph 84.
Yes.
Tell us about that.
Yeah, so a number of the visitor centres were able to provide food parcels, for example, for families. That was a way of maintaining that connection in the community, because they were locally based and knew the families that they were already supporting, families who had previously visited prisons. They were able to provide activities. There was one visitor centre service in particular that actually created an activity pack that the children could do outside the prison alongside the person who was in prison, so they were doing the same activities in parallel, as it were. So it was just a way of trying to create connection in whatever way they could.
The next section of your witness statement talks about influencing change. Reading it short, that's your policy work, yes?
Yeah.
So seeking to impact on SPS, Scottish Government policy,
Yes.
rather than the practical work, such as giving them information about how other countries were running video visits.
Yeah.
In terms of your policy work, we will look at that, but we don't need to look at that today.
Okay.
We have the witness statement, and it strikes me that's more to do with how decisions were implemented.
Yes.
And reached, and we're going to look at those later in the inquiry. At 94, you talk about hall telephones.
Yes.
And we heard last week from the Scottish Prison Service witness, Mr. Purdy, about the introduction of mobiles for prisoners. Tell us what your organisation's involvement with that was.
Again, it was, I mean, we were on the phone with the prison service sort of 5, 6, 7 times a day prior to introduction of both video calls and mobile phones.
Let me ask about that. Were you phoning them up and saying, hand out videos, hand out...
Well, they were usually calling us, but it was both directions. For information about where, examples of other countries that were using this, what kind of security measures were in place, why these types of things might be helpful, what ways can be introduced, I suppose, that would actually be functional and as risk-free as possible. So we were, in regular conversation about that, and again about the communications with families to provide information about these devices when they were finally introduced.
I asked you earlier about SPS updating their own website and whether or not they were proactive in terms of disseminating information. And I think you indicated they weren't. This does sound like an occasion on which they were proactive.
Yeah. Going back to the original conversation, it's not that they weren't proactive, they just weren't very fast. So we had those mutual conversations about the information that families would need. They know us to contact us about, to ask for information about that. It was the information wasn't available very quickly. And there certainly wasn't anything available at the beginning of the lockdown.
I'm looking at paragraph 95, where you talk about campaigning for 10 years, and we had gathered everything we needed, such as guidance practice from other countries. They were on the phone. You had all of this stuff. Presumably you gave it to them, but they were still on the phone to you 5 to 7 times a day.
Yeah.
in terms of their attitude, why do you think that was?
I think it's just for clarity, for kind of sound checking, I suppose, trying to get ideas, trying to get a clear understanding, trying to ask for more detail, asking for contacts, for specific examples. So, trying to make sure that we had the most current information from Canada, for example, as one country that had fairly positive experience with introduction of video calls and other types of visits. We're campaigning about other things as well, but I won't go into that. But it was just making sure that they had the detail and trying things out. Sending us drafts of guidance, sending us drafts of information, saying, would you have a look and see, is this right? What else do we need to include? It was that kind of exchange.
Could you read? Let me find it. Paragraph 97.
Mm-hmm. So 97, it says, after about 5 months, the mobile phone service was up and running. This was a positive step and was quickly introduced. And this was very quick for the Scottish Prison Service to introduce a new process.
So you regard 5 months as very quick?
For prisons, yes.
Based on your experience of dealing with them?
Yes.
Are they an organisation which are resistant to change?
Depends on who you speak to. I think there are a lot of good people who want to create good, positive change. I think there is a cultural shift that does need to take place to make change happen. Mm-hmm. It's a very large organisation, and just the sheer size of it does make it difficult. But I think there is a real shift, and we've seen quite a shift in the last 10 or 15 years, just in terms of transparency, in terms of willingness to engage with other organisations. But it does take time, and it does take. There's a prison service receives a lot of criticism, so I think there's a defensiveness that still needs to be overcome in order to make things better. That's a very sweeping statement, but that's our experience with them.
Almost in contrast to that, at paragraph 102, mm-hmm. you talk about the Prison Service commissioning your organisation
yes.
to carry out research on why those who hadn't taken up mm-hmm. virtual visits mm-hmm. Had failed to do so.
Yes.
Tell us what the outcome of that survey was.
Yeah. So,
you provide a 96% figure, mm-hmm. which is pretty stark. Tell us about the 96%.
Yeah. So the 96% of the families basically said that if they hadn't used video calls, they said they had the equipment they needed, but the issue was knowing how to do it, how to actually make the video calls and make them work properly. So that was the main reason they weren't using them.
So it was a lack of IT skills?
IT skills, but it could also be the technology itself wasn't functioning as it should. Again, sometimes not recognizing the identification they provided.
You're talking at the prison's end mm-hmm. rather than at the...
Well, it's through the service that actually provided. It was the Email a Prisoner scheme, which is provided by, and I'm trying to remember the name of the organisation.
We have it in the witness statement. It's
good, because I'm having a blip.
That's okay.
But yes, so there were some concerns about how that actually functioned in practice.
Tell me about the 5-minute warning that sometimes happened.
So before the end of a video call, they're limited to I believe it's 30 minutes at the moment, and they is a 5-minute warning before the end of the visit, just to say that the visit is about to end, and some people do find that off-putting. That was an issue, but however, again, 2/3 of the families were saying they were very interested in using video calls in future, particularly if they had help to overcome some of the difficulties that they'd had with the technology.
Now, often when visitors go into prisons, mm-hmm. they will leave either property or mm-hmm. money mm-hmm. For the person who is in custody. Yeah. You talk about that a little bit at paragraph 106. Mm-hmm. Can you tell us how that changed?
So that changed because they weren't able to come to the prisons anymore. They weren't able to drop off property, they weren't able to hand in money. So the prison service again introduced an electronic system for electronic payments, which was again something that was very welcome. Previously, you had to either hand in cash or send in a postal order, which obviously has a charge attached to it. So that was very positive, that families could then make electronic transfers into personal accounts for the first time. But they also had to post in property if they wanted to post in any items, any clothing. For example, they had to pay postage for that, which was quite a significant cost for families who simply don't have that kind of money.
In the final sentence of 106, can you just read that?
So the final sentence of 106 is, "This was very expensive for families and another impact for families who are already in poverty."
And has the requirement to post items in ended now?
It has. That took some convincing, because the temptation for many of the prisons was to continue that policy. We were able to argue against that, thankfully.
Okay. Now you spoke, you've said in the paragraph I've just had you read about already in poverty.
Yes.
You've also produced a report which is referred to elsewhere in relation to the impact, well, in fact, paying the price report. Broadly, what is the paying the price report which is referred to at 107?
This was a report, as a 20-month project that was commissioned by the Aberdeen Financial Fairness Trust, which looks specifically at the financial impact of imprisonment on the people left behind. That was, we were originally going to look at the pandemic, but that, again, the cost of living crisis was about to start at the end of the pandemic as well. So we spoke to 51 families about the impact. This is just before the cost of living crisis hit, and just as we were coming out of the pandemic. So what it gave us was a very clear snapshot of the financial burdens that families carry when someone goes to prison. What we found was that people were spending about half their income for people on remand and on release to support the person who was in prison, and about a third of their income while they were serving a sentence. So it was a huge proportion of income that people simply couldn't afford. So people were going without food, they were going without heating. They were, there was no kind of social activity. There was very social isolated because they couldn't afford to go out and interact, have social contact or play sports or anything like that. So it was a huge impact on the families.
At paragraph 113, you talk about the distinction between people who are held in custody or sentenced to more on the one hand and less on the other hand than 4 years imprisonment. Tell us about that.
Yeah, so this was specifically in relation to access to support. So this was about recognising that when someone is sentenced to less than 4 years, that they have what they call voluntary through care, which means they're not obliged to engage, and they can engage with a third sector organisation, for example. Those who are sentenced to longer will have a statutory through care, which is provided through criminal justice social work. So what we found was that a lot of the third sector providers, well, all the third sector providers were not allowed into prisons, which meant that it was quite difficult to engage with people in a voluntary capacity to let them know that support was available and to be able to provide that support on release.
Okay. You talk at 118 and 119 about the number of people who were assisted with training and awareness and so on. Can you just give us those figures for Brailsford?
So the number of people that we actually provide training for, and that can be training or awareness raising. We have accredited training, but then we also do a more general awareness raising input as well. So we had just over 1,000 people benefiting from the training and awareness raising sessions over the course of that year. It does fluctuate between 1,000 and 5,000 depending on the year. But that was actually, again, something that was helpful, is we'd never delivered that kind of training and awareness raising online before. but now it's a regular part of our offer, which is quite helpful.
At 118, you talk about your training and awareness raising. I mean, is that things like taking school teachers into prisons in the normal course of events?
Yes, that's what we did before. It was we would have what we call a twilight CPD sessions for teachers, where we would invite them into the prison. They would experience what it was like going through security processes to go into a prison, and then we'd have run a training session in the prison visits hall. For them to experience, so that way they would be informed to tell, be able to tell children in their classes, for example, what that experience was like, and hopefully raise their awareness of that experience, so they can understand what the children in their classes were going through.
And that obviously, whilst that might be an interesting and useful thing to do for teachers in general, where a teacher is dealing with a child who has a family member in prison, it's particularly significant.
It is, and it's very popular as well, just because it's something a bit different. But it also makes them aware that there might be children in their classes that have gone through this that they don't know about, because, again, families don't often tell schools or anyone else that this is what their experience is.
You say this is a twilight visit?
Yes, it means it takes place after school hours.
How do you get teachers to work after school?
Obliged to do a certain amount of training, so it fits in quite well. It means they don't have to provide.
At the risk of being intrusive, Mr. Caskey, 10 minutes.
Oh, that's fine, my lord. You talk at 124 about a new definition for elderly in prisons. Tell us about that.
So when you are in prison, you're considered elderly if you're aged over 50. So it is.
That makes me hate to think.
But it's basically because the level of health of people going into prison is often very poor. So you are deemed elderly if you're over age 50.
So if you end up in prison, you've got a lot of what I think doctors refer to as comorbidities.
Yes, absolutely. Lower life expectancy, many problems with long-term illness, chronic illness, respiratory problems, substance misuse, mental ill health, all sorts,
You talk at 129 of the difficulties faced by, as a result of difficulties with GOAMI, the people who transport prisoners.
Yes.
Again, can you tell us about that?
So again, what we hear is from the families who are concerned about someone who is in prison. So we were hearing from families about people not being taken to hospital appointments, chemotherapy appointments. One man in prison who had issues with a severe leg injury where they were worried he might actually lose his leg at one point because he was missing appointments. Follow-up appointments at hospitals, attendance at children's hearings where your children might be, might be discussions about children being adopted and you're not able to attend. So there's some real frustration, to say the least, about those appointments being missed. Transfers to other prisons are another one where you can't actually get to a prison in order to complete the courses that you need to apply for parole. So people were actually potentially staying in prison longer because they weren't being moved to the right prison.
You talk at 132 about a particular problem with next of kin information not being up to date.
Yes.
Again, tell me about that and then I'll have some more questions.
When someone goes into prison, they provide a next of kin for the prison records. That's not necessarily updated, so it's left up to the person held in prison to update that information if that information should change. What that means is that if something happens, if there's an illness, if there's a death in the prison, for example, the prison will contact who is the person listed as next of kin. But if it's not up to date, then the wrong person is contacted. So we've had situations where, for example, a person put his partner down as next of kin, that relationship broke up. His mum was in regular contact with him, but it was the ex-partner that was contacted when he died, and the mum didn't know until she found out on social media from the ex-partner. So, yeah, it's problematic.
Prison visitor, do the prison authorities have a system for checking up whether that's still your next of kin?
They can. It's something that was recommended in the independent review of the response to deaths in prison custody, was to make sure that information is kept up to date. At the moment, again, they leave it to the person in prison to have that responsibility, but the recommendation was to make sure that that is refreshed at least annually.
You've referred to that independent review in your witness statement. Can
Yes.
you tell us a bit about that?
So this was a review commissioned by the Cabinet Secretary for Justice that was looking at specifically at the response to deaths in prisons. Again, that review was started in November 2019. And it was had 3 co-chairs, so the Chief Inspector of Prisons, the Scottish Human Rights Commission, and myself, looking at, it was supposed to be a 6-month project, but the pandemic obviously delayed that considerably. It ended up taking place over 2 years.
134, you talk about an immediate difficulty in contacting an individual in prison.
Yes.
And is that something that occurs rarely or regularly?
In terms of, I'm trying to remember what this was. It is something that is, I would say, a regular frustration for families to be able to contact someone in prison, to know whom to contact. If you ring a prison switchboard, they'll often use lots of acronyms for things. So they might have a family contact officer, but refer to it as an FCO, and you don't know necessarily what that means.
You talk about dedicated telephone lines
Yes.
in paragraph 134
Yeah.
and them ringing out.
Yes.
Tell us about
So these were phone lines directly to the family contact staff, for example, that simply weren't being answered, or they would leave a message on an answering machine and not have that responded to. So that was certainly a problem in the past.
Yeah. Paragraph 136 to 138, you talk about peer support. Tell us a bit about that. Is that families supporting one another?
Yes, so this would be families who are gathering together, often groups of young people or groups of mums, for example, or it could be any kind of a range of different types of support, just making sure that families who have that shared experience are able to support with each other, because they often think that they're the only ones, so they have that real isolation.
The next passage of your witness statement relates to people in prison on remand. Now, we're going to hear evidence about the increase in both remand and the number of, or the length of time that people were on remand. We'll hear that evidence from elsewhere. What I'm interested in from you is the impact on families of that occurring.
So we've seen, as you will hear, that we've seen a huge increase in the remand population, as much because of the backlog in the courts. The court work was suspended, but also the maximum period of time of detention that people could remain in prison on remand was lifted during the pandemic, because in recognition of the fact that the courts were suspended. So what that meant for families is that it was difficult enough to know when someone would come out of prison or when they would have the result of their hearing, to know what sentence would be imposed, if any. But when that maximum period of time was lifted, it meant that it could be months or years before knowing what the outcome was likely to be. So that was extremely difficult, because there was no end in sight. There was no clear information about what was happening.
And at paragraph 143, you neatly loop back to your comments in relation to the impact of having an individual in prison, on the finances of the family outside. Presumably lengthening remand lengthens that period of up to 50%, 30% of income.
It was up to half of income.
Up to half of income for remand prisoners.
Yes.
You give some figures yourself at 144 about the remand population in Scotland, and say it increased from 20% of the prison population on 6 March 2020 to 30% of the population on 4th March 2022.
Yes.
Figures remain high, with 27% of the prison population on remand on 12th January 2024.
Yes.
So, although it's coming down, it looks as though it's coming down relatively slowly.
It is, yeah.
Is that fair to say?
Yes.
The next section is lessons learned. Lord Brailsford will read all of those. Can I just say, or can I just highlight, like many other third sector organisations, we've learned to work in a flexible way, is a song that we are all familiar with now. You talk at 147 about the need to consider prisoners and their families. Do you feel that was done?
I think so, in the sense that, again, we do have very regular contact with the Scottish Prison Service, and I think they can and do respond when they need to. We've just seen the release of the new Scottish Prison Service Family Strategy, as in just last week or 2 weeks ago, I think it was. So that is very much on the radar. I think we still have a lot of work to do with what that actually means in practice, particularly following incorporation of the UN Convention on the Rights of the Child. In relation to adult criminal justice, it's recognising this is not about 16 and 17-year-olds in the justice system. It is about the children who are impacted as a result of someone's involvement.
Mum or dad going inside.
Yeah, absolutely. So, or brothers or sisters or whoever. So we still have a lot of work to do. It's much more visible than it was, but we still have a long way to go.
The last thing I want to ask you about is 151, lessons learned for the charitable sector.
Yes.
You've obviously been in families outside for a long time, and you clearly have a firm grasp on what it is that you're doing, not just in families outside, but also in the third sector in Scotland. What do you say about lessons for the charitable sector?
I think so much. It's tricky because the funding year on year is very unpredictable, and recognising that for funding in the third sector, what we do is we receive grants in advance, and in a situation like the pandemic where you receive a grant and then you can't deliver on that grant, it does make it very challenging to be able to ensure that you can meet the terms of the grant or to sustain that, have repeat funding in future. So what you end up doing is trying to do something to show that you're doing your work, rather than handing the money back and saying, sorry, we'll just have to sack all of our staff because we're not able to do what we'd set out to do. So it was trying to justify our existence, which is often what we have to do in the third sector. It's a very frustrating situation to be in. But it is the reality and thankfully, again, through our own organisation and what we saw with the prison visitor centres, for example, we were able to show that we were able to make that constructive use of that time, even if it wasn't what we'd intended to do when we originally received the funding.
That's interesting. There's just that last comment, sorry. One of the things that we've heard from time to time is third sector organisations saying, prior to the pandemic, our budgets were ring-fenced and closely supervised by the funding provider. Did that change in your experience during the pandemic?
I think it was still closely supervised, but they were much more willing to be flexible in how it was used because we had to be. So that did change, but it did result in a lot of very close conversations with funders, both through grant-making organisations and through Scottish Government.
You've provided effectively first-person testimony from families at the appendices. I was going to have you read those, but pressure of time means that Lord Brailsford will need to demonstrate his literacy. I did also say to you that I would tell you that's all the questions I have for you. Is there anything that I haven't addressed that you think we need to address?
You talked about the telephone access and contacting the prisons and how difficult that was for families. One of the results of the independent review was that the Scottish Prison Service has just introduced an urgent concern telephone line for families. That just started in January this year. So it's been a long time coming, but again, it's something that was put in place eventually. So a family member
can phone up and say, I'm concerned about John, my brother.
On the menu that comes up when you ring the switchboard, one of the items is if you have an urgent concern about the safety of well-being of someone in prison, press 9 or whatever it is. And that is a very welcome change.
Thank you. Thank you very much.
Thank you.
Yes, indeed. Thank you very much, Professor.
Thank
Very
you.
grateful. Good.
Thank
Lunch.
you.
1:30?
1:30.
Very good.